The Tuskegee Syphilis Experiment. From the years 1932 to 1972, the United States Public Health Service, a division of the U.S. government, conducted a study on the effects of untreated syphilis on a group of 600 African American men. Out of that group, 399 men were infected with syphilis. By the end of the study, only 74 were left alive. None of the infected black men were ever given proper treatment by the researchers in those 4 decades, nor were they ever informed that they had syphilis. According to contemporary sources, the Tuskegee study has been deemed as arguably the most infamous biomedical research study in U.S. history. Why? Syphilis is an infection commonly spread through sexual activity. Common symptoms include sores, rashes, fever, weight loss, hair loss, and can eventually cause blindness, arthritis, brain damage, and death. For centuries, humans struggled to find an effective treatment. Eventually, in the 1900s, the US government wanted to test their hypothesis of syphilis having different effects based on race. Thus, in 1932, in the city of Tuskegee, Alabama, public health officials secretly selected a group of 600 black men to participate in the study. Nearly all of them were impoverished, poorly educated sharecroppers. They were told they would receive free medical treatment, meals, and stipends for their participation. However, none of them were ever told that they had syphilis. Instead, they were told that they had quote-unquote bad blood, and were given placebos by the researchers. The study, originally meant to last 6 months, ended up lasting decades to see how the disease would lead to their deaths. Even after penicillin was discovered as an effective treatment for syphilis in 1947, all of the participants were still denied proper care. The director of the CDC at the time, Raymond A. Vondeler, met with local black doctors and asked them to deny treatment for the black men in the study. The researchers reasoned that they weren't harming these men, under the presumption that they weren't likely to ever receive treatment anyways. By 1972, only 74 men out of the 399 infected were still alive. According to Wikipedia, of the original 399 men, 28 had died of syphilis, 100 died of related complications, 40 of their wives had been infected, and 19 of their children were born with congenital syphilis. The United States government was silent about this study until it was leaked by a whistleblower. And despite the US helping pass the Nuremberg Code several decades ago, in order to protect the rights of research subjects after the events of the Holocaust, this is what was done.